Heartbeat E-ECP. That is a great new word that I've learned. Heartbeat E-ECP means heartbeat enhanced external counter pulsation therapy. With me today, of course, is Dr. Sri Nelson Kok JP, the co-founder. And I want to ask Dr. Sri this question. What is the intention, objective and mission of having this heart E-ECP, especially in Ipoh City?
Billy, I think to bring back to my, in the years, 12 years ago, when I went for full body checkup, medical checkup, and the specialist saw my result and tell me that you have two narrowing of the artery, and that explanation, that finding resulted me in very anxious how to improve on my health. And the specialist told me tomorrow to come and do the statin because you must come, because it's a narrowing down, quickly come over. Tomorrow afternoon we do the treatment for you. But I went back and checked with my personal doctors and give the result, and they said, yes, true, you got to do narrowing down artery, but do you have the symptom? So I explained that I don't have the numbness, I can breathe, I can walk, Then the doctor, yes, it's normal because at your age of 55 at the time, narrowing down is very common, especially the calcium build out there. So you don't need to go first. Go and change your life. Do not drink anymore. Not like you want to sit at the life. Occasionally, and control your diet. Do a lot of exercise. And recommended my friend to do the E-ECP at that time. So I went through the 30 treatment consistently every 2 days to go, to finish up within 1.5 months. And after that, I feel myself different. Okay? And I continue to exercise. I go and do hill climbing, walk the Batu Cave, So after a few months, I started to go and conquer off in the mountain. Wow! And that was immediately after 3 months of that exercise. And it carried on. And subsequently 4 years, I need the Mount KK climb out. And until today, I feel still the same. I'm very, very healthy. And because of this treatment, I want to encourage more people to help more Malaysians, to go and do this non-invasive treatment. Because if I would have done that the operation today, I would have to have a few pieces of medicine daily, to consume, and that may be helpful to me. But with this treatment I have gone through, I find it's so helpful. Thus, I later on started to venture into the business, because I think the cost of treatment is low, not like you go into the outpatient, that costs about quite a big sum of money. Plus the after effect, you need to consume medicine. These are non-surgery, and that's why I use my business experience in the Nelson franchise to expand this, to establish a well-known brand in the KL region and come back headquarters, slowly expand to other cities. Now we have 8 branches now.
8 branches, wow. Well, as you can see, there was PST, personal storytelling by Dr. Sri Nelson, a person who doctor has advised to go either for stenting or medication, but he found the safe and non-invasive way, that is through E-ECP. And I want to thank him because this is sharing our stories. For those of you who are very scared of going through stenting or bypass, this is the safest proven method through E-ECP, and that is where is for you to YTD, just to discover us. Come talk to us. discuss with us, and we will show you the way through a healthier, happier, harmonious lifestyle. Thank you for listening and have a great day. Thank you, Sri.
Thank you. Thank you very much.
Hello, good day to all of you. Today, I'll be speaking about something very important. It's about HEALTH. Well, my name is Katie, the host for this incredible channel, and we will be speaking about heartbeat E-ECP. And E-ECP will be the magical word of the day. With me today, of course, is Dr. Dhirubhai, the doctor in charge. Good day to you, sir.
Good day to you, Mr. Katie.
My first question is, what does E-ECP means? And a bit about the history of this magical word.
Okay, first of all, let's go to what is E-ECP is about. Okay, E-ECP is Enhanced External Counter Pulsation Therapy. Okay, it is a non-invasive therapy. This therapy is actually advised for patients who are having a poor blood circulation overall in general. So mainly patients who go for cardiac examinations, for example, patients who are planned for angiogram or planned for angioplasty or bypass, this kind of patients are recommended to continue this therapy because this therapy helps them to improve their circulation overall.
My next question will be, E-ECP involves a unique mechanism. Can you explain how it enhances blood flow and oxygenation within the body? How does it work?
Okay, E-ECP, it has it's a machine that actually has its own caliber of mnemonic cuffs are placed. So there will be 3 cuffs which is placed over your calf region, over your thigh, and over your hips. And the patient will be set up on a cardiac monitor as well. So what we do is we will study their heart rhythm. According to the heart rhythm, synchronization of the beat occurs, and during your heart diastole, which is your heart relaxation mode, the cuffs will start to pump, squeeze more blood. So what happens is the blood flow towards your heart will be enhanced, and during your next cycle of your heartbeat, more blood flow will be enhanced throughout the whole circulation, and this actually helps you with formation of new collateral vessels. So this is what we call as angiogenesis.
Wow, that is truly something very, very incredible. For me, it's a learning curve today as a layman in terms of health matters, but it's really getting interesting. My next question, Dr. Dhirubhai, will be, how do you determine who is an ideal candidate for E-ECP treatment? Are there any specific medical conditions that benefit most from this therapy?
Actually, yes and no. So who could be the yes category is patients who already have a full blood circulation, such as example like patients who are already in diabetic. So patients who are diabetic actually have a very small veins and vessels over the end of their lower limbs or your other parts of the body. So normally this kind of patients will benefit from E-ECP. Apart from that, patients who are cardiac based patients, for example, patients who are based for who are on regular blood thinner medications, who are actually planned for an angiogram, planned for a bypass. Normally these patients, the blood supply are blocked, and the certain organs don't get the proper reach of oxygenation because of the poor blood vessels. So this therapy will help them to enhance formation of new collateral vessels and enhancing their circulation overall and blood supply.
Interesting. I once remembered a friend of mine who was a doctor. He mentioned our legs is actually a second heart. Is that why you need to pump it from the calf and your legs? Why not from the brain or from your hand and so forth? The reason why it has to be the calf.
Okay, it's a very good question actually. Okay, what we say our legs are the second brain is because our majority of the blood vessels, big vessels, are all formed below our knees and above. Near our gluteal region are the most prominent blood supply, and we have 2 major vessels over here, our femoral arteries. So these are the possible blood supply that is supposed to be pumping out towards your heart.
Doctor, run through with us briefly the entire treatment process of an E-ECP session. And what can patients expect during a typical session like this?
Basically, what our sessions comprise of is actually has 35 sessions. So each session will take them 1 hour. So the pumping mechanism is going to go for at least 1 hour. So through that process, 1 hour pumping mechanism, that time when your heart receives more blood volume that it never reached before, so the pumping mechanism from the heart and the blood flow through your circulation is already way a lot than compared to how it used to be. So through this process, what we advise is patient also should commit themselves to a better lifestyle after doing our therapy. So they will be able to do more activities than usual. For example, they won't have this fatigueness, they will lose their shortness of breath, they'll have a better sleep, and metabolism rate will be higher, and this helps them to improve their quality of life.
We know that the heart is the only organ that have not stopped pumping the day you're born, and that has to go on. What we need to do actually is to prolong our life, to ensure that there are non-invasive ways for us to do so. And I'm so thankful, being Ipoh, there is a branch in Ipoh city itself that can do wonders. So if you know of mothers, sisters, brothers, relatives, neighbors, associates who need this particular therapy, this is the place to be. E-ECP right here in Ipoh. Can you please share a memorable success story of a patient, right, which experienced significant improvements through this E-ECP treatment?
Yes, actually we have a few patients who have a success story. As I remember, there are 2 patients actually who are actually planned for a bypass initially. This happened in KL. So one of our customers who approached us with a very bad prognosis, and they will not prefer to go for an invasive procedure. So they understood the risk that there is a risk for a open heart surgery. So they have opted this therapy, and successfully within 35 sessions, they don't need to go for an open heart surgery. So we have successfully reversed that kind of risk factor for the patient, and the patient currently is living healthy after almost for a year now.
Wow. So you heard it right from Dr. Stoff. Wow, that is also this treatment which can basically be made non-invasive for you to ensure that you continue life in a very comfortable way. Well, doctor, I'm only waiting to go onto the particular machine and to be treated the E-ECP way. But remember, heartbeat E-ECP, rest a while, run a mile, let me just add, with a smile. So keep smiling and the world will smile with you. Thank you very much for listening.
Thank you. Okay, Mr. Kinti, are you comfortable right now?
Very comfortable.
Okay, so we have wrapped you with this our mnemonic cuffs. So you will be feeling like a massage sensation. So you actually will pump according to your heartbeat. So when your heart is relaxed, these cuffs will start to pump and give you good circulation towards your heart, and overall your circulation will be improved. Okay, so Mr. KT, do you know what are the benefits of having a very good circulation?
Not really.
Okay, so first, if a good supply towards your brain, first you will have a very good sleep. It reduces the risk of getting stroke and Alzheimer's and dementia. So this provides you a better rest at home. So apart from that, towards your cardiac, a good branches of collateral vessels will be formed over your heart region, so help you to reduce the risk of getting a heart attack. So if it goes to your liver, improves your liver metabolism as well. If it goes to your pancreas, a good circulation will enhance your own body's insulin production. So hence, if you're a diabetic patient, it also helps in diabetic patients. It also improves circulation towards your kidney region by 21%. Yes, so this helps you to active removal of toxins and waste product from your body. And also towards your lower limbs, a good circulation to your lower limbs helps you to prevent a risk of getting deep vein thrombosis as well. So there's a lot of magical things going to happen. Hope you have a very good session. How are you feeling now?
Oh, what a feeling! I feel so relaxed, rejuvenate, re-energized, and reborn. And that particular 1 hour, I tell you, I went in dream world. This is something, doctor, I believe everyone should try.
Yeah.
Because seeing is believing, trying is more believing. And I want to thank you for the honor of me having this incredible treatment at Heartbeat Enhanced External Counter Pulsation Therapy. Remember, rest a while, run a mile with a smile, everything will be okay. So we look forward to a bigger, brighter and better future together, and take care of your heart.